My name is Darren Pan. I'm one of the hematology oncology fellows at the Icahn School of Medicine of Mount Sinai. And when it comes to whether CAR T cell therapy is effective in extramedullary disease, I think what we've seen in our cohort here at Mount Sinai is that, generally speaking, it is effective in inducing a response for patients who have extramedullary disease. And in many cases, it can even be a pretty deep response. We saw that for at least our patients with extramedullary disease of less than 50 centimeters squared, measured by the standard IMWG method. Just to give you a sense of perspective, that's about the size of a tennis ball or smaller cumulatively. That amount of EMD burden seems to still respond pretty well to CAR T cell therapy, with over half of patients experiencing complete responses, meaning that at some point on their follow-up PET scans, any appearance of the extramedullary disease radiologically had disappeared. And so CAR T cell therapy seems to be effective at inducing this initial response. Unfortunately, what we see over the long term is, one, that patients with the largest EMD burdens, so higher than 50 centimeters squared, do not experience the same deep response as patients with lower extramedullary burdens. Most of those patients either progress right away or shortly after their CAR T cell infusion. The second thing that we've seen is that even among patients with lower extramedullary tumor burden, just having pre-existing extramedullary disease at all continues to be a high risk factor for having shorter progression-free survival. And so even when we see that extramedullary disease on follow-up scans is seemingly eliminated by CAR T cell therapy, at least visually, what we can see long-term is that these patients still relapse more quickly than other patients. And so while CAR T cell therapy is effective, it's not doing what we hope in terms of inducing deep and durable remissions for the majority of our patients with extramedullary disease. And so I know here at Mount Sinai and at other institutions, one of the next big steps is trying to better understand why it is that extramedullary disease seems to be so resistant to CAR T cell therapy. It doesn't seem to be that antigen loss, so downregulation of the BCMA target, is the answer, because in our cohort, 6 out of 7, so the majority of patients that we looked at, continued to have high BCMA expression in the majority of their cells. So whether it could be something in the actual extramedullary tumor, in that microenvironment that's inhibiting CAR T cells from working properly, that could be the myeloma cells themselves, or it can be some of the supporting immune cells, which we know can sometimes work against us. That's something that needs to be further studied, and I think in the coming years we'll start to get a clearer idea.